Yeah, why don't we go ahead and get started? I want to welcome everybody. It's good to see everybody. There's still a few people jumping on, but let's go ahead and get started. I'm Marty Exline, the Outreach and Training Lead for the AT3 Center. And I want to welcome everybody to today's webinar on the Assistive Technology Public Health Workforce Grants. The purpose of today's webinar is to provide an update on how Assistive Technology Act programs are utilizing ACL's public health workforce grants. And I think most of you know the AT3 Center is the national training and technical assistance provider for the state and territory AT programs under the Administration for Community Living. And many of you have been involved in meetings following the awarding of the funding last year. And we've worked to track different approaches by the AT programs. And the state and territory programs are taking a wide range of approaches and activities. Some projects are underway, while others are in the planning stages. There are some AT programs that are contracting with other entities. Some are combining their public health workforce funds with other entities. Some are using funds to begin a new project, while others are utilizing their workforce funds to continue a project that had been previously operated under another source. The AT Act programs have until September of 2024 to utilize the funds, and you can jump to the next slide. Have until September of 2024 to utilize the funds, so there's plenty of time for programs to that are still thinking about the best approach for your state. And we're fortunate today to have several AT programs kind of give an overview of their AT public health projects. If you have questions, please post them in the chat and we'll address them either at a appropriate spot during the webinar or at the end. So go ahead and go to the next slide. We appreciate today having Rob Gronendahl, the Administration of Community Living AT Program Director, who's going to give an overview of the Public Health Grant Program. Arlene Lugo with the Connecticut Tech Act Project, Angela Stanridge with the Texas Technology Access Program, Melinda Dolezal with the New York Trade Program, Jeannie Crow with North Dakota Assistive, and Carol Weber with the Assistive for the Kentucky CATS Network. So with that, go ahead and jump to the next slide. And with that, I'm going to go ahead and turn it over to you, Rob.
Yeah, hey, thanks a lot, Marty. Appreciate that. Hopefully everyone can hear me okay. It's great to be with all of you today. And I'm going to talk a little bit about the purpose and background of the public health workforce funding. And so, clearly, this is obviously a very important initiative, for all of us. AT Act programs play an essential role in expanding the capability of the public health workforce to meet the unique needs of people served. Well before the pandemic, the AT Act programs have been trusted and reliable resources in communities across the country, providing people with disabilities, older adults, families, caregivers with direct services related to health and social needs, activities that address social isolation and social determinants of health. A while ago, it was back toward the end of 2021, ACL made the case that the AT Act programs could play a critical role to expand and help reach the underserved communities through the public health workforce funding made available through ARPA, the American Rescue Plan Act. The purpose of the ATPH grant awards is to increase public health workforce funding with capacity and expertise in disability and assistive technology, and that funding is designed to increase the number of staff who are already doing the work. Marty mentioned that the grants were distributed in January 2022. 1 year ago, it was actually January 13th. I remember when ACL's Office of Grants Management distributed those ATPH grant funds to state and territory programs. And so it has been a year, but as noted, we're still working on what is doable for these funds. There's a wide range of eligible services and supports. Like all American Rescue Plan funding, it is time limited, one-time funding, but there's a lot of room, and that's why we're all here meeting today, for flexibility, creativity with these ATPH grants. Funding can be used to cover wages and benefits, as well as the costs associated with equipment, training, and supplies for these professionals. Grantees could hire new staff, hire contract staff, pay existing staff for additional hours. Temporary staff can be hired. Independent contractors are allowable. You can hire different types of public health workers depending on what the priority needs are in your communities. Could be a community health worker, case manager, community nurse, assistive technology specialist, communication specialist, someone who works on public policy where you are, public health policy. As with all of ACL's programs, grantees, of course, are encouraged to target funding to those with the greatest needs, those who might be underserved. And there's ways to advance equity. Grantees may use the funding to add staff for public health services to people with limited English proficiency, focus on improving cultural competency for health programs, increase the organization's ability to reach underserved populations with this ATPH funding, as well as similar activities. ARPA allows for flexibility to provide for a variety of public health workforce staff, such as an assistive technology specialist. Public health staff hired with these funds can include a myriad of positions. Those are listed in the FAQ. Even AT programs came up with some other terms: digital divide coordinator, assistive technology ambassadors, assistive technology technician, other positions required to prevent, prepare for, and respond to COVID-19, social support specialist, community health worker. So there's a number of ways of approaching this. And so ACL distributed the funds through the existing grant funding mechanisms for the ATAC programs in the payment management system. Therefore, the formula AT programs, all of you, all 56 of the ATAC programs funded under Section 4 of the ATAC, did not need to do anything to apply for this funding opportunity that occurred a year ago. And the funds were pushed out directly in the PMS. So the funds will be available, noted previously, until September 30th, 2024. Certainly it can be used over any period of time before that date. ACL would like to see the money put to work as soon as possible. So encouraging states kind of moving forward with proposals. There are a number of states who have started to draw down the funds. There's a total of $4.4 million. That's $80,000 for each of the 56 state and territory act programs. And so I think we're going to head to the next slide after this by focusing on some examples of how ATAC programs are utilizing funds in Connecticut, North Dakota, New York, Texas, and Kentucky.
All right, I'll take this as my cue since that's my slide. Thanks, Rob and Marty, and everyone. Thanks for allowing me to be here today to present on our program, Bridging the Digital Divide. I'm Arlene Lugo. I'm the program director for Connecticut's ATAC program, and we use this money in partnership with our state unit on aging to create a new program, which is a variation of our previous program. So you can go to the next slide, please. So when CARES Act funding was issued, our state unit on aging asked to partner with our program, the ATAC program, to help serve consumers with disabilities and older adults in Connecticut. So we created a program called Stay Connected. And we collaborated to try to help reduce social isolation, provide technology to individuals to help them engage, participate in telehealth. And it was a good program. We did a lot of service. We helped a lot of people, but there were gaps. And so we were able to take the data and really look at, what were the gaps? Where did we, fall short in serving individuals? And we tried to fill those gaps by creating this program. So we've created 2 full-time equivalents called Digital Divide Coordinators. And some of our colleagues shared some of the job descriptions that they were looking for, and we were able to take that information and kind of create our description. If anyone wants to see it, I would be happy to share. Working together, working with MOUs and contracting, it took us a little while to get things underway, but we are in contract with 2 of my Tech Act project AT partners, each providing 1 full-time equivalent of a digital divide coordinator. And we are currently now serving adults with disabilities 18 and older, as well as older adults 60 and older who may not identify as a person with a disability. We are also serving community agencies. And this is one of the things that's a little bit different than our previous program, in that we're actually helping to support agencies as they support this population. Senior centers, community centers, libraries, and disability organizations. Next slide, please. So the truth is, the funding that we received, we're very grateful for, but we could not have created 2 full-time equivalents in our state without collaborating with the state unit on aging. And so thankfully, they were kind of in a crux because they had funding that they needed to expend, but they didn't really have personnel or expertise. And I had the person power and expertise, but not as much funding. So in talking about those gaps that we weren't able to fill with our previous program, they were able to commit funding from a variety of funding sources that they had. And so we have my AT Public Health Workforce Funds. They used a No Wrong Door ADRC Public Health Workforce Funds. They're also using ARPA funding, and then some other additional Title III ARPA funding, which is allowing us to purchase technology. So without them, we really wouldn't be able to have a robust program that we think we're going to be able to implement in Connecticut. So just looking at my talking points to make sure I cover everything that I wanted to say on this slide. The other thing is we were hoping to be able to partner with our independent living centers in the state. Because the Bureau of Rehab Services, our vocational agency, is my lead agency, and they also receive funding to give to the independent living centers for public health workforce funding. And because the person in charge of that contract happened to retire, I volunteered to help write the contract amendment for those services. And in collaboration with State Unit on Aging, Centers for Independent Living, and myself, we were able to identify very similar services that they're going to be doing at the independent living centers through a different person called Community Health Advocates. They'll do a lot of the similar technology coaching and supports with individuals with disabilities and older adults. They just won't work with the entities the way we're going to. So that's the one big difference. But it does allow us to increase the number of individuals providing support in our state. Next slide, please. So our digital divide coordinator provides services to individuals directly. They might work one-on-one or in groups. And essentially, if there's a person that has technology that's struggling to use it, and they would benefit from some type of training to connect to Wi-Fi, use their social media to connect with family and friends, access virtual platforms, Zoom, or virtual senior center programming, or for telehealth, if they want to learn how to use their accessibility features or connect to any other community supports and resources, then our DDCs can work with them. Next slide, please. Also, thanks to the State Unit on Aging and the budget line item that they've given us, if the person is 60 and older and needs technology, then our DDC can use their judgment to provide a tablet, case and screen protector, and a 1 year of prepaid hotspot. Part of the services they're also providing to individuals is to connect them to the Affordable Connectivity Program or other public available resource to allow them to connect to broadband. But we can give them this prepaid hotspot and then work on that with them as we go. If a person comes to us who is under the age of 60 and doesn't have technology, then we're going to have to tap into other resources like the independent living centers or other grant programming, or even our libraries in the state that are also doing a very similar type of programming. Next slide, please. Thank you. As I said earlier, the other kind of unique part of this program is that our DDCs are also working with entities and organizations directly. So if an organization serves adults with disabilities or individuals over 60, and they want to learn how to better support their clientele, learn how to set up accessibility features on their own technology, learn how to help their consumers connect to virtual programming and virtual services or telehealth, or help their clients access social media and do other type of online activity, then our DDCs can do group trainings to their staff. And this can be virtual, it can be in person, it could be hybrid, and that's true for both individuals or entities. It's really, we're trying to work with whatever works best for the person or entity that's receiving the services. Entities can include places like senior centers, libraries, the AAAs in our state, even the SILs will receive training from us as part of this program, so their community health advocates can do a better job of supporting individuals. So because of the whole contracting and getting our applications going and getting the process up and running, it took us a little bit of time to get started, but we did officially start our program in October. So we do have 1 quarter worth of data from our DDCs. So far, we've served 63 individuals. In general, people are calling because they need a device, they need training on their device, they need internet. 2 calls because they wanted training on accessibility features, and 2 because they needed help with accessing telehealth. Right now, you can see our stats. The majority of people that have reached out to us are between the ages of 60 to 80. Some younger individuals as well, but mostly older adults. In terms of ethnicity, we've got 62% not Hispanic, 38% Hispanic or Latino. The majority of the people we're serving so far live alone, and about 48% of the people so far are at or below the federal poverty level. There is no criteria or eligibility to be served under this program in terms of as long as you're 18 and older and have a disability, 60 and older, and you need this type of support. But we're still kind of trying to track this information to know if we're serving people that are at or below the poverty level, what their breakdown is. We are trying to target lower income and underserved populations as well. We don't have the data yet from our independent living centers, but we are trying to align their data with ours so that we can give a bigger picture of what our state is doing. We hope to have that data by the end of this month. Next slide, please. And then in terms of entities, that's been a little bit slower. So far, we've served 9 entities that have included public libraries, senior centers, a veterans group, visiting nurse association, and elderly housing. 89% of the entities that reached out to us for support were because they want to learn how to support their clients with accessibility, tech support, and virtual programming. And we've been doing a lot of outreach. We also have the opportunity to work with the AARP speaker series in our state. They were looking for topics, and we basically were able to do a 1 hour per month with them, specifically on accessibility features for computers, accessibility features for tablets. We'll have 1 hour session just on our programming. So we're really trying to get the word out there. We're also going to be advertising through the AAA newsletters, our own newsletters, and other public awareness events out in the community to get the word out there. In terms of data collection, I just want to mention we're using a program called Job Forms, where we created basically a case management system for our DDCs to input data for the individuals they're working with and entities. And that's how we're able to get some of the data that I shared with you today. So we are hoping as we continue this program that we can really start serving more people and more entities, and that kind of train the trainer model helps a greater number of people in our state. Next slide. So that's pretty much it for me. I hope I stayed within the time frame. If anyone has questions and you don't have a chance to ask today, or you want more information, you can reach me at my email, my work cell phone, or visit that webpage listed on the screen, which takes you to our Bridging the Digital Divide program. Thank you.
Thanks, Arlene. And now we'll move to Angela.
Hi. Also with me today is yeah, the slide's advanced. Okay, is the person we actually hired, Nico Nelson. He's our public health outreach program coordinator, and then our contact information and website is there if you have questions for us afterwards. You can advance the slide. So TTAP did something completely different, just like Rob said. There's all kinds of stuff going on out there. We are housed at University of Texas at the UCED within the Texas Center for Disability Studies. Well, the UCED also got the exact same ACL grant to fund a public health position. So we combined our funds to hire one person together, but fund that position for 2 years. And that funding would include salary, fringe, indirect costs, travel, and equipment and materials, and any obligations outside of that we agreed to pay out of other either grants that we have, or we call them local accounts here that are not grant accounts where we get funding from other sources like fundraising and stuff like that. So that was nice because the UCED actually got more than the AT programs. I think they got like 113,000 or something like that. So it's a pretty secure position for 2 years. The public health partner relationships and obligations already existed for TTAP and UCED, so it made sense for us to collaborate because we were already working on a lot of similar projects anyway. Also, TTAP has a unit goal to diversify our team, so we were also going to try and hire outside of our middle-aged white woman box. And we could not find a person with experience in both public health and assistive technology. So we opted for hiring a public health expert and then training the assistive technology skills. So we initially published the position for a while and did not get any takers. And then we decided to up the salary and revamp the description a little bit. And then we had some applicants. And so that's how we arrived at hiring Nico. And then in the meantime, we're also going to search for a grant to sustain the position because we want to keep it going. You can advance the slide. So I'm going to tell you a little bit about what TTAP's plans were with the position, and then I'm going to let Nico tell you about what the UCED and AUCD are having. He's a little bit like a child with two-step parents because he has to answer to both of us. So we each kind of, I manage him and so does the manager for the other unit. So it's a little bit of a split personality job, I guess, but they're still kind of intertwined because we do have similar objectives. So for the position, our objectives are for Nico to develop his AT, ICT, and accessible telehealth skill sets. So he's kind of starting from knowing just a little bit about it. And then he started in August. So just in a few months, he has greatly increased that skill set. And he'll be going to ATIA to really increase that skill set. To expand his understanding of people with disabilities and aging and the AT connection. So he did come to the table with a little bit of background with people with disabilities, but that AT piece is new. He has already supported TTAP in a lot of outreach activities in public and private health entities that we probably would not have touched otherwise. So for example, he did an activity down in the Valley that was focused on providing access to COVID information and vaccines, and probably I would not have expended staff and time for to go to that particular event because it wasn't AT specific. Now he was able to share AT stuff at that event. So it's a broader reach than we had before. And that would include state, local, county, and CPOs. Support TTAP's current COVID-19 vaccine testing projects and procedures for people with disabilities. So when COVID came along, Texas kind of formed this group of stakeholders that support people with disabilities, and it's a whole mix of private organizations and public organizations and state agencies and federal agencies. It's all mixy matchy. And if you're AT program people and you looked at my one big thing from last year, that's what I talked about. I'll put their website in the chat. Oh, there is no chat for the big people. Well, okay, you can email me and I'll give you the website. Anyway, but that particular group, many of them are also funded through ACL or have connections with other entities that are, and they got public health personnel funding also. So we've kind of tried to network those public health positions through that organization that was already there. And it's continuing to support people with disabilities in our state beyond just the COVID crisis. They're sort of branching out further, which is a good thing. And then eventually, as Nico's skill sets improve, I want to develop some tools specific to telehealth and AT. So that includes website resources with the public health and assistive technology connection. AT Telehealth 101 for consumers. This would probably be on our public YouTube channel and kind of a little bit more broad and generic. This would tie in well because with our loan library, because some of our ADRCs partnered with us to use funds to buy items for our loan library to support telehealth for people with disabilities and who are aging to be able to utilize telehealth visits. So, you know, like an oximeter and a cardiomobile and a blood pressure cuff, so you can do your visit with your doctor and be able to do all the things your doctor needs you to do for that visit. And those are available in our library, and it would also support people being able to know how to use them if they had them on their own. And then an AT 101 geared more toward public health practitioners and professionals. We would probably not make that public facing. It might be more like a Canvas course or something, and we might possibly look at offering some CEUs or something, since many times those professions they're not motivated for professional development unless they can also collect CEUs of some kind. And then other duties as assigned, right? Also information and assistance, training and technical assistance for public health and assistive technology, and things along those lines. And you can advance the slide and I'll turn it over to Nico to tell you more about what he does for the USAID.
Thanks, Angela. So as she said, I'm kind of a split personality, wear many hats at the center. As part of the USAID's plans, right now I'm an ACT-1 trainee. I was at AUCD. I met a lot of folks. I believe I was at the AT-SIG with Rob. But yeah, it's been a really awesome journey so far. I mean, very short journey, but I've learned so much along the way. I've learned so much only because of the great support of this team that we have, especially Angela has been a great positive reinforcement. But yeah, I guess with USAID's plans, it's been one, trying to increase more clinical trainings for the public health practitioners, OTs, speech paths. We have a bunch of other, even for family members and self-advocates, we're trying to increase exposure and experiences to when it comes to screenings, assessments, again, clinical training. And part of that is also developing this research board or advisory board that we want, because we want informed, better research. And that's only going to be happening with self-advocate input and feedback, and also trying to have a diverse advisory board of folks with disabilities, including family members, professionals, and self-advocates. So that's something I've been tasked with, to try to find my research, I guess, Avengers of research. So that's something we just started doing, and I'm actively looking for folks or candidates, but it's something that will be developing as my position grows. Also, we are in contact since December with the State Office of Rural Health. We're looking at a program and training that we have here at TCDS, which is trauma-informed care and road to recovery. I will throw the link in the chat after this, but it is essentially a program that teaches medical professionals how to better address the disability community, the IDD, ASD community, in terms of being informed that trauma is something that is very, very complex. It's seen and unseen, and it's things that may not necessarily be at the top of our minds when we're dealing with clients. So this is something that the state of Texas, State Office of Rural Health here in Texas has been wanting to expand, especially in rural areas. And this is directly tied with telehealth. And this is something that we've been wanting to improve upon, is our accessibility in telehealth. Because geographically, as most of y'all know, Texas is a pretty big state. So getting out to places like to the Valley, like where I was doing the event with COVID information and AT information I was disseminating, it's an 8-hour drive down there from Austin. So it's like driving to places is not, it can work. Boots on the ground is definitely something I appreciate. I love doing and talking with people, but it's not accessible in terms of getting our information and resources out to people in a timely manner. So what we want to do is take telehealth, improve upon it here at the center, and then also get this training in the hands of medical professionals, but also users of all kinds, so that they can understand their trauma and how to best, I guess, have more informed decision making when it comes to their health, especially in rural populations, because there's been a huge, especially with the 2023 to 2028 Texas State Health Plan, it's been outlined that there are large disparities between rural Texans and urban Texans. So also taking advantage of the AUCD network, I have joined the Spanish Language Caucus and ARP, which is a research board that takes a look at ASD, IDD communities and tries to improve upon so far as research efforts go throughout the country. I just had my initial meeting with ARP yesterday, and I'm hoping to continue that journey and all the, I guess, special interest groups that AUCD offers to improve upon my position, because we really want to expand not only the intersections of like disability and LGBTQ initiatives, but also within our like Spanish language communities, our Latino population. There's a lot of disparities between like non-white Hispanics and Hispanics, and definitely like Black and African American people we want to be reaching out to, just mostly like expanding it beyond just probably our main consumers, which is probably like middle class white Texans. So that is one thing I'm hoping to see blossom. And then also, as part of being an ACLN trainee, there's a practicum built in with that. And it was supposed to be just a semester thing, but I've been working with Disability Rights Texas and trying to expand our, I guess, coverage so far as disaster preparedness and awareness. And really, it's blossomed into this whole project of planning a disaster, very, like, I have to underline, inclusive disaster planning conference. We're calling it a clinic, but we want to host this clinic in Houston during Disaster Preparedness Month in September, so that all, I don't know if you say Houstonites, I'm not familiar with the term, but folks from Houston and the surrounding areas within Texas, we want them to come to this clinic, learn how they can do disaster preparedness in a way that's effective, very, very succinct, and very to the point, so that people can make quick, informed decisions, because during an emergency, you don't really have that much time to make decisions. So just having information right there readily available, having a backpack ready, really what we want to do is have this one pager. It's a one pager of information and context that you can have. And this would be very, very helpful for the disability community, just having this information readily available, ready to go in case they need to do something in a snap decision. So that's just a small snippet of what I'm doing. I don't have any numbers or statistics to back it up, but we hope as things grow on, as we do more research, as we kind of expand our outreach and effort in other communities, we hope to have more results. So that is what I got. So thank you for having me.
I'll add too that Nika's bilingual, so that really helps with a lot of those objectives that both TTAP and the USAID have. But thanks, guys.
Ooh, I'm guessing it's my turn. I'm gonna go as quick as I can, because I know there's a couple more states after me. So in New York, we're focusing pretty much exclusively on telehealth. There's a lot of overlap with what some of the other states are doing. We focused on some of these bullet points in the original kind of ARPA, guidelines that we had gotten about where the funds could be used. So in New York, you can go to the next slide. This is just kind of stuff that I think we all had. So we ultimately chose telehealth because New York is, has a really big population and we have 12 trade centers. So we didn't think it would be an effective use if we gave a little bit to every single trade center to do the same thing, because New York City obviously has a bigger population than a more rural area up in the North Country. So what we chose, and we knew we couldn't really hire a position because of our status as a state agency and the time and energy it takes to create a new position within the agency and sustainability. So what we came up with was a telehealth project based on feedback from our advisory council and then also our developmental disabilities planning council. It was similar feedback that, during COVID, like in the really, the really rough points, we would give tablets, iPads in particular, to people to use for telehealth. And then they would just sit on a table because somebody, didn't know how they worked. They were embarrassed to ask about it. And then they would just end up, it wasn't a good use of A, the tablet, and B, the person that was using it would just be frustrated. And that goes, primarily we noted it, for older New Yorkers, but it could be anybody. It could be somebody with a developmental disability that's, never really had anything like that, somebody that's younger and just doesn't have experience with it. And for us, this is something that we could use statewide, that, we could create and then, get out to our networks. So with the telehealth project, you can go to the next slide. What we came up with is we're actually going the Hollywood route. We are creating 3 short videos. We actually shot them yesterday, so it was a very long day. We borrowed a trade center for their location, and we were able to shoot them all. So the 3 videos that we're creating are the features of an iPad and how to use them. We did poll our staff to see, what are the most common devices that people are using. Almost all of them are using iPads. So down the road, we may look at doing something for Android, but this is where we are for the time being. And it's very basic, how to charge it, where the port is for the charging cable, how to know the battery, how to connect to the internet. The second is tips and guidance. Once you've watched the first one, the second builds on that to kind of know what to do for an effective telehealth appointment, knowing how to connect to everything, again, the Wi-Fi, where you should be, if you need somebody with you, stuff like that. And then the last one is a little different. It's targeted at healthcare professionals who are the ones that are, potentially doing a telehealth appointment, and just tips and reminders for them to, potentially be patient. Not everybody has experience using it, and everybody's busy, everybody's got stuff going on, but it's really just kind of that nice friendly nudge to, take the time to really, work with somebody that may not have that familiarity with accessibility features or maybe hard of hearing. So we wanted to kind of cover those 3 areas. Go to the next slide. So as it says, we shot it yesterday. We started early in the morning. We were done pretty late in the afternoon. We scheduled it at this particular facility because they have an adaptive kitchen, a sensory room, and a computer room, and they have all of their equipment pretty much readily accessible. So we were able to use one of their iPads for that purpose. And we know that obviously there's different generations of iPads, there's different sizes. So we kind of tried to keep the language very generic. And, we said that, it's most of the certain areas that we were talking about may be in a slightly different spot. The volume buttons might be in a different location, but this is what they will most likely look like. This is the app, image for Safari, stuff like that. We shot it up in Queensbury. If anybody's familiar with the upstate New York region, Queensbury is a couple hours south of Lake Placid. So it's in a really nice area. And we pretty much took over their whole facility, brought in lights, cameras, all kinds of stuff. We hired an actress that speaks both Spanish and English, so the videos will be available in both languages and they will be captioned. They will be edited and produced by our state media services. So it's all kind of being done in-house. So all of those resources were kind of, we explained to them what we wanted to do, the target, demographic, because at the end of the day, our trade staff are available if somebody has a question about how to use a device. If they borrow it, they get it home and they forget how something works. We're always happy to talk it through with them. We're always happy to do trainings. But what happens at 8 o'clock the day before an appointment, somebody, trade's closed and somebody needs something, or it's the weekend. So with this, our goal is to, have these readily available on all of our telehealth devices that we have out available for loan. So there'll always be a resource if the person needs it. And then also available for download for any other state partners or stakeholders that might want to use it. So we also have partnerships with our Money Follows the Person, Access VR agency, as well as early intervention. So we'll be, they are very excited for this. They think that it would help, for more than just telehealth, because obviously, we call it our telehealth project, but it'll also be in many ways geared towards, individuals that want to use it for social isolation, but don't have a lot of experience with smart devices or tablets, or going to, classes or programming, whatever it happens to be. If you go to the next slide. So yeah, so our goal is we're going to have them uploaded. We're hoping they'll be done around March, April, in that range, and that'll give us time to really do some publicity around them. We do a lot of conferences and we do a lot of outreach that will be really kind of talking a lot about these. We've already done some initial outreach to let people know what to expect. We'll be sharing them with our networks. We're on a lot of different committees in New York, the Developmental Disabilities Planning Council, accessibility work groups, Access VR, state partners, funding, resources. So this will be something that we'll definitely be telling a lot of people about. And then again, also available for free as a download on our website. So I don't have a link quite yet, but we're in process of kind of getting that all together. After this, because we actually didn't use all of the funds, we're looking at some additional uses of other types of videos like this. So we've kind of tapped into some other agencies in New York to see like what are their needs there, if our state partners have any additional input. We also got some clarification on kind of the purchase of tablets. So one thing that we do want to do is get some additional tablets that we can bring to trainings for the AAA staff, ADRCs, our developmental disabilities agencies, so that we can have them with us to train their staff as well. So we're trying to hit like 6 or 7 birds with one stone. So this for us was the most effective way to do it. And then if you want to go to the next slide, that may be it for me. Yep, that's me. If you have any questions, it's been a process just getting everything together because we are a state agency. It's a lot of kind of back and forth and coordinating. We had blizzards right before we shot our videos, so we were really worried we wouldn't be able to, but we ended up, it worked out very, very well. So yeah, that's what we're doing in New York.
That was amazing, Melinda. I love that. And the other speakers, that's all such good stuff that I'd love to copy someday. With our grant, one of our goals as an organization has always been to build capacity in the area of assistive technology because we're such a rural state. And one of the things we've always wanted to do is do regular webinars and trainings and videos, excuse me, like other states have been able to do, and we just haven't been able to get it going and didn't have the funding, didn't have the staff. We've had other priorities. So this grant really came around at just the right time, and really all the stars kind of aligned because we had somebody go on maternity leave and wanted to come back, and we couldn't hire her back because we'd already replaced her, and she is a very experienced ATP, and so next slide, please. So we created an assistive technology training specialist with these dollars, and basically to provide that training that we so long to do, and basically organizing and implementing training for professionals and individuals across our state. We're also using it to do a webinar series and create a library of assistive technology equipment videos, kind of how they all work, and really as basic as even how to use a bed rail or a tub rail. So, because believe it or not, people get it wrong. And then designing a web page to really host all of these web page or pages to host all of these. There's some up there now, but it's not organized the way we want it to. Next slide. And this, just going back to North Dakota, we started that grant, so started negotiating with our lead agency starting right away in January of last year. And it took us a while to get the contract together. And we started that contract in July and started doing the webinars in August. So, I mean, that's the benefit of having somebody trained. We were lucky with that. And she was just able to go with it and started doing the training. And while we were doing that, the wonderful Amy Perrone from Minnesota Star said, hey, I'd love to collaborate with you and spend some of these dollars. And so now we actually have a contract with Minnesota Star, the Minnesota Assistive Technology Act program, and we're helping them do kind of the same thing. And so, which is really fun to be able to collaborate with them. And we're co-branding all the videos. We're doing pre and post surveys and online polls, and then we're giving them the data. They're helping us plan them, and we just started this month with that contract. So this is what's going to happen, and then same with the equipment videos that we're doing, and we decided an agreement to be paid per webinar and per video, which includes captioning and all the accessibility needs for each video, and then they can post them on their website and do all the same kind of things we can. We go to the next slide. And right now are the webinars that we've done 4 of them so far, and they are on our website at that link. And we've done smart home basics, AT for wandering, smart home routines, remote monitoring. And then I think the next one in February is medication management, and then it will go on from there. Specifically in the Minnesota contract, we are doing 5 ICT webinars that was part of the agreement along with other things, which is really cool. That will help us as well with fulfilling our ICT requirements. And you want to go to the next one? Thanks. And the equipment videos are in progress. We have shot many of them, but then we're going to be going back and reshooting some of them with some of the co-branding. Some of the devices we've already done, 1-button talking alarm, stop power lock, just real simple videos. And actually these videos have really come in handy. We have another capacity building grant through Money Follows the Person, the Olmstead dollars, and we have AT ambassadors. By the end of 24, we will have 25 AT ambassadors. These are volunteer positions throughout the state of North Dakota. And right now we have 7 so far. We just started with that. And this training will also help them and build their capacity. There was some training in that grant, but not a lot of dollars for that. So this is really helping build that program as well. And that's really all I have. Let's see, I don't think, is there another slide? No, I think my contact information is on the first slide, but anyways, so if you would like to have any of the materials or anything like that, just give me a call. And I think you're up, Carol.
All right, hi, I'm Carol Weber, and I'm with the Kentucky Assistive Technology Services Network, and we decided to use our money to do a public health information accessibility project. And the person we have hired to fulfill this is Ryan Creech, and I'm going to hand it over to him and let him tell you all about the project.
Hey, hello, everybody. Yeah, so I'm Brian Creech, and I am the person who got hired to work on our Public Health Information Accessibility Project. You can go on to the next slide if you like. So the idea came from, as we were going through all of this stuff with the COVID-19 pandemic, our governor and like their messaging team, the Department of Public Health, made a really big deal of addressing people with hearing disabilities. It came to the point where even in the picture here, you can see Virginia Moore. She's our state's, what did we decide she was? She's the commissioner of the Kentucky Commission for the Deaf and Hard of Hearing. She became a celebrity because she was up there every day with the governor, interpreting for his coronavirus briefings. Like she had fan clubs and everything else. And so like they really pushed. And later on in the pandemic, when it was really kind of miserable, the governor started having Virginia do like a sign language word of the day. And so it was really encouraging to see the administration embracing disability so much, but they were really focusing only on those people with hearing impairments. So our hope was that we could take that same kind of energy, that same direction and commitment, and use it to improve access to the public health information for other groups too. Next slide. So this is just, you guys are tech act agencies, what kind of disability stuff we run into, but just looking at disabilities here in Kentucky, we've got 33% of the people in our state report some form of disability. And so, I kind of marked down like the more important ones that are related to, accessing information. So like 15% of everybody in our entire state reports some kind of cognitive disability. 10% of the people in our state have some kind of independent living challenge. So, accessing that information and applying it and understanding it. And so, and then we've got 9% of people in Kentucky have hearing impairments. And so that's what the governor's office was focused on. They were focused on 9% of the population, which out of the 33%, and I'm sure there's some crossover, but does definitely not address the needs of everybody in our state. Okay, next. So the solution we came up with was our public health information accessibility project. So these are kind of the main goals of the project we put together, providing free evaluations and technical assistance for any organization or group or business that distributes public health information to people in Kentucky. That could include like evaluating their websites, evaluating documents, like if they've got PDFs or even printed materials they want us to look at, providing technical assistance if they need it with kind of remediating those things, and then providing online and in-person training to kind of help improve that all the way around. When we first kind of approached the project, we were looking to do kind of from the bottom up, like go talk to small clinics and things, and then work our way up with this part. But what we discovered was that most of the small clinics and local health departments we talked to didn't have the staff, didn't have the resources, didn't have the money or the time to really put the effort in to get all of these things done. So we ended up deciding to go to the top instead. We found out that also most of the materials they were distributing were from the Kentucky State Department of Public Health. So we ended up just going up to the very top and starting with the big fish for that. But we are looking at identifying secondary sources of COVID information, whether that's like it could be something like a church, group that meets regularly, or community group that kind of puts out information about COVID. And we just want to make sure that they are getting the information out to their people in the most accessible manner possible. And then the other thing we wanted to do is kind of build a library on our website of the trainings that I mentioned before, so that we can train people to create all kinds of accessible communications. And so by helping the public health information distribution groups, then we kind of identify where the needs are for training in that organization, and then kind of generalize those out to the rest of the state. Next step. Yeah, so like I said, we kind of ran into a block with the smaller health departments. They just didn't have the resources to kind of work with us one-on-one. So we reached out to Dr. Stephen Stack, who is the commissioner of our Department for Public Health, and kind of explained a little bit about accessibility challenges, and we even sent over some videos, and if they got sent properly, they'll be on the next slide when we get there. But we kind of showed, there was an infographic on our website that explained what you should do if you've been exposed to COVID. And the infographic was completely inaccessible. So we sent a video of what it sounded like to a screen reader user. And then we kind of went through and remediated the PDF, and then sent a video of what that sounded like to a screen reader user, and how much easier it was to actually get useful information out of it. And so he was absolutely like taken in by it, pushed it all the way up to the Cabinet for Health and Family Services, which is where the public health department is located. And everything was going really slowly on our end. And we found out it was because all of it was getting pushed up to the Secretary of Cabinet for Health and Family Services, Dr. Eric Friedlander, who was like really excited about the project and decided he wanted to make it a cabinet-wide initiative. Like, he wants to make sure that all of their stuff is accessible. Next slide. So yeah, so here's the infographic. You can see the graphic itself on the left. And so just, visually, I mean, like the contrast is horrible. There's way too much text there, and it's not organized super well. But if you will click on the original screen reader clip, the button, there it is. Thank you. I guess we don't have the audio. Okay. Well, the closed captioning up at the top, you can see that it is reading it, but it's in a really weird reading order. So there, okay, yeah. So it's jumping around, and like it instead of reading down each column, which is what visually should be happening, it's reading across the page. And so like you're hearing like each section kind of across. Sorry, did I mess you up? I guess
Oh, you keep
fix the
talking.
audio.
I'll figure it out.
Okay.
I'll figure it out.
Okay. So yeah, so once we get the audio, you'll be able to hear. But yeah, so using JAWS, I mean, this graphic made absolutely no sense to anybody. And even visually, as I said, the color contrast is so bad here that sighted people were having trouble accessing the information as well. All right, you want to try that one again, Jamie? It's gonna do it. I think it's gonna do it. Okay. Well, anyway, so we used, I mean, we use this as a practical example, basically. So we took and we showed them, you know, this is the crap that you're putting out, and then this is the much better stuff that you could be putting out. And so, like, as I said, Dr. Stack was very interested, you know, understood what we were looking at and our level of concern, and made sure that it got all the way up to the secretary's office. So we've been working since then with several cabinet level officials, since, you know, we are kind of focused on the COVID-19 stuff. Like, we're mostly working with the Department of Public Health, but the materials that we're developing on how to create accessible PDFs and so forth are all stuff that can be used, you know, by the entire cabinet, and hopefully they'll work them up to the entire state too. That's all right, Jamie. Let's just skip on to the next.
I'm trying.
Okay. Okay. Yeah. So far, we hired the employee, that's me, to develop the training materials, provide the
Oh,
technical
for
assistance.
crying out loud, sorry.
No, you're good. So we hired the employee, and that's me, to also to market the resources. Just like earlier before the chat, we were talking, or we found a conference for the public health agencies in the state, and so, you know, like going to that conference to market the program, you know, and possibly even present on the program and what we could offer to those people. So, you know, when Carol and crew were originally designing the grant, they were concerned about finding the right person, because they needed somebody who had the technical skills to, you know, go in and like do deep analyses of the websites and the documents, but they also needed somebody who could do training, you know, and train people well, and also do that kind of public facing thing. And so I was the only choice. I work as an assistive technology specialist for Kentucky Vocational Rehab, and Carol negotiated away 50% of my time so that I could kind of handle this. So like the other projects that I think was North Dakota, maybe, I'm doing part-time. So since I'm doing half-time, we're able to spread the grant over 2 years instead of just one. And the Cabinet for Health and Family Services has already kind of expressed some interest in possibly hiring like a full-time accessibility coordinator once this is over, to keep up with this stuff. But yeah, so like I said, we've met with them. We've recently completed an evaluation of their website, their COVID website, and a whole bunch of terrible PDFs from their website. And we've also started collecting materials for the resource website that we're going to host. So again, we're going to be producing some of our own materials based on the specific needs that we find as we go through, but we also want to aggregate a lot of resources that are already out there. Our biggest obstacle so far, like our communication with the Cabinet for Health and Family Services, has been spotty and slow. And like I said earlier, part of that was because everything was being run all the way up to the secretary, and we didn't know that at the time. But also, like, just some of them don't get back to us super well, and so we're still trying to figure out exactly how to overcome that. Again, obstacle, finding somebody who could be the staff person, but also, you know, when you're dealing with a program that's like this, where it's just a 1 year salary grant, you've got to find somebody who's highly skilled technically, but willing to take a job that definitely ends in a year. So yeah, luckily I was already laying around, so there we go. And then, you know, just kind of the other thing that's been an obstacle is it's taken us a long time to, like, we kind of jumped in with Department of Public Health, but like we kind of didn't have process together. Like we weren't really sure how we were going to do the evaluations exactly, how we were going to report back the templates. And I'm okay. Yeah, I'm sorry, Marty. I'm done. All right. There you go. Now everybody can pause that when they're watching the recording.
Thank you so much, Ryan.
I talked way too long.
You did fine. You did fine. Yeah, some great presentations. Really appreciate everybody's sticking around. Obviously, some really innovative approaches. Everybody, I think the presenter was doing something just a little bit different, had some common themes, but a little different. And I would say the same is true with the other AT programs that are implementing the public workforce grants. I didn't see any questions in the Q&A other than somebody had asked Arlene whether they were getting back to their to the people that they're providing devices to see if they're continuing to use their devices.
Yeah, great question. Thank you. So part of the data that we are collecting, it's a little bit robust. We are collecting upfront data around, you know, the person's current technology, use of technology. We are now using the UCLA loneliness scale. Prior to that, we had a more complex social isolation scale that was very complicated and hard to collect data pre and post. So the UCLA loneliness scale, which we got from one of our colleagues on the call, is quicker. And we still have some individuals that are hesitant or resistant to respond, but at least we're getting some pre-information. And then on the back end, after training is done, we plan to ask him the same question again. We've only had one person that's gotten through the whole process so far. And we did notice an improvement in their responses. But in addition to that, we are also asking other post services questions like, you know, how do you feel the services have impacted your quality of life? And are you using the device for telehealth, social media, you know, things like that. So we do hope to get some of that information. And one other thing that we're trying to gain from our digital divide coordinators are more robust anecdotes and stories with photos, so we can highlight people as we present, you know, to whether it's state officials, the governors, our commissioners, ACL, or anyone else. So hopefully we will have some really good stories that we can share about the impact of the services on the individuals.
Great, thanks, Arlene. You know, I'll just touch on this one more question and then we'll go ahead and cut off because I know we're over time. Clayton had asked how many programs, one of the questions was how many programs indicated in their FY21 and 22 APR that they plan to draw down the funds. And it really is, most of the programs plan to draw down funds. Very few have said that they don't plan on it, and some are at different places in the staging process. So, and I don't have information on how many have begun to draw down the funds. So I want to again thank you to each of you that has presented really fascinating approaches, and thanks to everybody who was able to attend today. And we will, with that, we'll go ahead and end it and have a great afternoon. Thanks, everyone.